800,000 new strokes occur in the U.S. each year, with a devastating effect on the patient, their family, and the healthcare system as a whole. We spoke with Dr. Ross Levine of Lee Memorial Health System about the importance of knowing the symptoms of stroke so that immediate treatment can help minimize the effects.
So when we have stroke, we typically have a disturbance in circulation. Most commonly, the blood vessel, the artery that carries the oxygen to that part of brain or eye, most commonly that artery closes. And most commonly when that artery closes, it has to do with either a primary disease of the artery or a secondary closure. For instance, a blood clot arising from the heart, floating upstream and secondarily closing the vessel behind the eye or in the brain. So that's the most common. Less common would be an area of bleeding in the brain or eye.
Stroke is a medical emergency.
When a person has the abrupt onset of inability to speak properly, of weakness or numbness on one side of the body or the other, severe headache would be in the category to warn us about stroke. Severe imbalance, disequilibrium. The combination of those symptoms, the sooner we can evaluate the patient, the sooner we can determine one, is it an ischemic or dry stroke versus a wet or hemorrhagic stroke? And then two, if it's an ischemic stroke syndrome, does the patient in front of us qualify for our only approved therapy, that being a clotbuster therapy?
There are definite risk factors for having a stroke.
So patients with smoking, high blood pressure, sugar diabetes, cholesterol abnormalities, blockages of their heart arteries, blockages of their leg arteries, that's the typical population that's much more stroke prone than the next.
Dr. Levine discusses prevention of stroke, which closely follows strategies to avoid heart attack.
If you have high blood pressure, the more well-controlled that is, it minimizes the risk of stroke. If you smoke, we can get you to stop smoking. For example, if you stop smoking, one of the statistics that I know about is in 5 years from the day you stop, your risk, if you stay away from smoke and secondhand smoke, your risk would go down to the risk of a non-smoker if you've gone those 5 years not suffering a stroke. If you have diabetes that is out of control, again, getting it as exquisitely controlled as possible. If your cholesterol is high or your bad cholesterol is high, getting those things as normal as possible. If you're sedentary, getting you to exercise. So there's a whole series of common sense, practical, based on your risk profile, practical common sense advice that we go through. Pre-diabetic and pre-hypertensive, or borderline diabetic and borderline hypertensive, those really are the people at risk. And if we're not going to be paralyzed or blind or unable to speak or wheelchair bound from a stroke, we're going to want to back up to the younger people, to the prevention, to be healthier, so we can have many more years of good, healthy living and not be a burden to ourselves, to our families, economically a burden. Most stroke specialists like myself consider even one TIA, even one, a failure of prevention, even one. So we want to back up and have people prevent everything, even the little warning spells. Although granted, if you have a warning spell, it focuses us even more on what's trying to happen. But we want to prevent everything from happening as much as we can. And that's really where the future is for our patients, is to keep them as healthy as we can.
For more information about Dr. Levine or the Lee Memorial Health System's neurological services, call 239-454-8725 or visit leememorial.org.